PRK is photorefractive keratectomy, actually a laser procedure used to help correct different types of refractive errors such as nearsightedness, farsightedness, and astigmatism. We perform PRK to help patients become less dependent on glasses or contact lenses. It's probably less well known, I would say, than its colleague LASIK. But actually in this country, it was the surgery that was performed first. It was actually FDA approved before LASIK was. So mid-90s, PRK was the first laser refractive surgery to be performed in the United States. Today, it's been surpassed in number by LASIK in terms of number of patients treated. It still has a very important place, though, in terms of who we treat. PRK being a surface ablation, we don't create a flap, so we do have to take the surface cells of the cornea off with a chemical, an alcohol-based chemical, creating a large corneal abrasion, and then we do the ablation right under that epithelium. Because of that, patients have to wear a contact lens for 4 or 5 days while their corneal epithelium repopulates the cornea and heals. Otherwise, there'd be significant discomfort with it. Additionally, the visual recovery for PRK tends to be considerably longer than it is for LASIK. Whereas LASIK, patients are seen well within a day or two of their surgery. With PRK, it does take longer. In the end, the result between PRK and LASIK is pretty equal. I mean, they're going to see as well as their LASIK counterparts. It just takes them longer to get there. After their surgery, after PRK, the patients will use an eye drop to help the healing process. This eye drop is compounded. It has 3 components: an antibiotic, a steroid, and a non-steroidal component. All 3 help with the eye in the healing process. So following their PRK surgeries, we advise all patients to go home and really plan a day of rest. It's better when their eyes are closed following this type of surgery. They'll have less discomfort. When they wake up from a several-hour nap following the surgery, their eyes will feel better. We encourage them to use lots of artificial tears for comfort, and then to use the compounded eye drop, which is helpful in the healing process. Avoiding rubbing the eyes is also a very important part of their healing process. Recently, had the opportunity to operate on a young female patient who is a college athlete, and she came in asking about LASIK, and we actually advised her to have PRK instead. She is a lacrosse player. She had her surgery. She was very nervous about it. She did great, though. We gave her some preoperative sedation, orally, as we give all patients. She did the procedure wonderfully. She tolerated it great. And at her last visit was 2020. I'm very happy. Sent me a very nice thank you letter afterwards.